Now, a seemingly simple light test could hold the key to detecting Alzheimer's disease at an early stage, according to research carried out right here in Lancashire. Lancaster University and the Lancashire Teaching Hospitals NHS Trust have worked together on the study, and researchers say the results could play a vital role in diagnosis. Well, Dr. Trevor Crawford from Lancaster University's Department of Psychology and the Centre for Ageing Research joins us this morning. Doctor, thank you very much for joining us this morning. Simply explain the test and what you've been doing.
Hello, good morning. Yes, the test is quite simple. What the participants are asked to do is to simply look at a screen, and just as when you are reading you would move your eyes directly to the word, in this test a light appears on the computer screen and you simply ask in one test to look straight at it. But the most important test really is slightly more complicated and involves more activity of the brain, and that's where the light appears, but this time instead of looking at the light we ask people to move their eyes quickly and accurately in the opposite directions. It sounds odd, but people do get the hang of it.
So how much of a breakthrough is this? Because I know that scientists all over the world have been looking into
Yes.
Alzheimer's and how to detect it early on. How much of a breakthrough is this?
Well, this is quite important as a promising test, because one of the problems we have as health professionals know is in early detection of the disease in its early stages, and also finding a reliable test that's convenient for patients to do. And this is a problem across the world. So this is a promising new avenue of research that we've been working on and hope to develop in the next few years, because it may provide an alternative and more simple way of getting an early indicator of whether Alzheimer's and dementia is present in the patients.
Because whenever we talk about this, the diagnosis part of dementia and Alzheimer's, I'm sure we'll have people calling this morning, is a really, really big problem, isn't it?
Yes, that is the problem, and it's particularly difficult in the early stages of the disease, because as you know, as we all get older, you may find this, that we all become a little bit more forgetful.
Yeah.
And the concern is, if you've got a relative or you know other people who have got Alzheimer's, you begin to worry that maybe this is something more serious, or possibly not. And unfortunately, it's very difficult for the medical profession and GPs to really be certain in the early stages whether this is a serious problem or whether it's just a normal problem of aging.
This sounds fairly simple. How come we've only thought about it now?
Well, part of the problem really is that the equipment and the technology that we use is really currently mainly based in universities. Not many hospitals really use this sort of equipment at present. So the universities, my lab and other labs around the world, we've been studying this for a number of years, but it's only recently that it's been, interest has been expanded, and the hospitals are beginning to find out about this technique. We hope these things will change in the next few years.
Yeah, and how long before we could see this test being widely available to people?
That's the big question. I'm afraid we're at an early stage, and we do need to do further research on this. At the moment, we've been testing patients who have established Alzheimer's. Right. We've only done really a relatively small study. So what we'd like to do in the future is to do bigger studies, and also to try and get people in that early stage I mentioned before, so we can actually show that the test is going to be useful in that early, difficult time to diagnose.
And if people do get an early diagnosis of dementia or Alzheimer's, what does that mean?
Well, I think that would be really important. All health professionals, I think, and the health service recognise that's really one of our targets in the next few years. It's important because it will help families to manage their affairs. It will, when treatments become available, they will be much more effective if we can get them into participants, into patients at an early stage before the brain is deteriorated, too much. It's the same with a lot of neurological disease. The sooner you get the diagnosis, the better, really.
So this sounds like very positive news, but people shouldn't get carried away, because it sounds like you're quite early on in your research about this.
That's exactly right. We're still at the research stage, and it is looking promising. This is the second, report we've published on this, so it's looking consistent. But we still need to do more careful work before it becomes more widely available. That's certainly the case.
Dr. Trevor Crawford, thank you very much for joining us this morning, and keep on working.
Thank you very much.
That's Dr. Trevor Crawford, who is from the University in Lancaster. from the Department of Psychology and the Centre for Ageing Research, joining us this morning.